Throughout the world, decade after decade, young people's mental health has been neglected and stigmatized. SAMHSA's 2019 report discovered that adults between the ages of 18 to 24 from every background have been diagnosed with depression. These individuals' education range from grade 8 completion to a year after grade 12. After coming out of my own complicated dive with mental health, I feel compelled to share my insights with others through this presentation. I feel like it's my ethical responsibility to do something about it, after all I have gone through. And ultimately, practical action is the most important thing to handling America's mental health discussion. Because mental illnesses are so widespread in America's younger generation, teaching about awareness/education on the subject continues. This is important for citizens like you, dear listener, in order to understand and tackle what is happening to America's children. Despite this reality, there is a widening shift within American culture regarding whether or not to continue the promotion of mental health awareness. This divide exists primarily because many parties believe that solitarily awareness is useless when uncoupled with action. It is more crucial to shift efforts away from mental health awareness and towards systemic change through action than it is to handle the issue's symptoms.
Stigma
begins to grow and fester when societies fail to actionably tackle their mental health issues properly. Ultimately, stigma is a symptom of the healthcare system's neglect of mental illnesses, but the stigma still creates lasting harm. Many ancient writings categorize mental illness as a religious or personal problem. America instituted mental health asylums during the mid-1750s as alternative care for families. Though these spaces were believed to be the last resort, the facility's population grew during the 1950s. Patients did not have many other places to go, as poorhouses were unsuitable options. In a country where there's a history of mismanaging conditions to help the mentally ill, it is no wonder that there is a need to re-educate the population. Because of stigma, individuals can develop a warped view of youth who have mental illnesses, avoiding them as much as possible. Encouraging people to interact with youth who have mental illnesses helps to eliminate the stigma that they are a threat or alien. This act also helps to un-isolate those who suffer.
Someone who is suffering from anxiety and depression is already thinking that they are the outcast and that they do not belong in these social groups. An individual struggling with depression wants someone whom they can trust and talk to, not feel judged about their situation.
Informational narratives, an effective form of education, combine the benefits of both an emotional tie and a data-driven story. These narratives give those who share and those who hear the story a sense of understanding and empathy. Consequently, these actions provide a space for stigmas to be alleviated, providing more youth with mental illnesses to be open about their struggles. After hearing these stories, individuals who
do not
experience adverse mental health have the opportunity to confront the biases and misinformation they have effectively. However, stigma's effect on the healthcare system goes deeper than relating to people and spreading information. These stigmas leak into the public consciousness and the healthcare system itself, leading to unequal care for those who suffer. Frequently, mental health awareness discusses the misinformed claims and dissonances about the reality of mental health. The leading causes of stigma within the system are lack of understanding, therapeutic pessimism, and skills.
The consequences of allowing these types of stigmas to grow result in an individual's unwillingness to seek health care and healthcare workers giving their patients poor service. If a youth attempts to receive care and is then mistreated or not taken seriously because of their mental illness, this becomes exceptionally discouraging. Oftentimes, mental health disorders are underdiagnosed and certainly undertreated. What generally happens is that most people do not get treatment for it, or they might get some treatment, but not effective treatment.
Provided youths do not try to find care within the traditional healthcare system, mentally ill individuals fall back into a cycle of isolation. However, hospitals are breaking barriers within the system's culture by creating practical hands-on programs to empower their staff with tools to adequately engage and meet their patients' needs. Most people can be led out of their destructive thought processes when put into an environment that prompts them to reconsider their beliefs and understand what is at stake if they do not. For example, during a study of an anti-stigma training session, Javid Suketa and Saad Chanin facilitated open conversation and prompted students to enhance their perspectives and counter internal stereotypes. Not only that, but the students commented on how their physical environments in the hospitals reinforced their fearful engagements with the mentally ill.
Students commented on how panic alarms on acute inpatient psychiatric units supported their bias because contextual and environmental forces perpetuated it. Their intrinsic bias grew because it was required and encouraged within that environment.
The reason awareness of mental illness fails to affect the profound change, like breaking the barrier of healthcare access, is that the mere knowledge of an issue's existence does not equip people to know what to say and what to do. Because awareness fails to sustain itself here, action in the form of anti-stigma programs is much more essential. Secondly, action is more essential than understanding because proper healthcare for mental illnesses is financially inaccessible to most individuals. There are several reasons why those with mental illnesses cannot receive care, but the main one is because it is expensive. According to Morgan Landhart, the average cost of traditional mental health services in America for youths and adults ranges between $65 to $250 without insurance coverage. The disease is usually lifelong for clinically diagnosed patients, so costs can build up quickly over time, averaging $10,836 a year. For those who cannot afford insurance, they might be able to get short-term care at an emergency department or clinic, but that is not good enough. Many psychiatrists and therapy services that accept insurance end up leaving their patients drowning in debt or paying out of pocket. Alternative care such as an emergency department and community clinics is not sustainable for the healthcare system to have floods of children coming to such underdeveloped programs. These programs are not designed to serve the mentally ill for long periods, and in the past 2 decades, they have become increasingly short-staffed.
Talk to just about every RN working in an emergency department, whether adult or pediatric, and you will hear the same concerns and stresses. Too many patients, too few nurses. What kind of quality care can you give to your patients with that load? They put us in an impossible situation, running from patient to patient.
While awareness is good for empowering people to be more likely to reach out for professional assistance, youths will likely get discouraged once they reach the facility's door. The reason for this is because of the long waits for in-person services. But because of COVID-19, many physical and mental health services turn to the internet, which has helped to alleviate this issue. The reality of stigma's impact and the financial insecurity of accessing proper mental health care can become a daunting reality for people, but there is hope. The best ways to effect long-lasting change for the future of America's youth are to develop a relationship with them and helping them to find professional assistance.
Amid what can be a painful, surprising, or even frightening emergent reality for a parent's child, they also face the daunting task of making difficult and sometimes confusing decisions. In some instances, this results in intensive advocacy on their part.
Along with this, voting for politicians dedicated to expanding and building quality mental health care services is a very incremental step. With the expansion of these services comes the training of more mental health specialists and the mental health education for citizens, which helps understaffed facilities. There's no promise or proof that individuals' actions can cure mental health illnesses. Ultimately, quality care and access to that care provide a better chance for healing. And even then, there is no promise that the treatments will work either. But providing the opportunity for youth to try is what matters most. Action stands on its own, while the power and purpose of mental health awareness remain in the background as fuel and guidelines for creating change within a society's culture. This understanding is primarily for the benefit of a child who suffers from mental health complications now and for the well-being of America's future. In the end, America will become more caring for the children it fosters. Through the necessary strength and power of collective action, changes can be made to the hearts and minds of America's society and systems.